Today, we are very privileged to have a panel of 3 join us in chapel to have this discussion. Dr. Anna Lemke, she currently serves as an assistant professor in the Department of Psychiatry and Behavioral Sciences at Stanford University School of Medicine, where she also serves as program director of the Stanford University Addiction Medicine Fellowship. She is chief of the Stanford Dual Diagnosis Clinic and the chief of the Stanford Addiction Psychiatry Initiative. As a member of the Stanford faculty, Dr. Lemke sees patients, teaches, and has focused her research on understanding the socioeconomic and cultural factors driving addiction. And so we're blessed to have her with us this morning. Dr. Audrey Seaton-Bacon is a practicing psychologist and a Biola alum, so that's super exciting to have her back. She holds degrees from Johns Hopkins Rosemead School of Psychology. She has continued her training in analytic consultation groups at the Listening Perspective Study Center and has continued her studies also in relational psychoanalysis at the Newport Psychoanalytic Institute. So join me and welcome her. Thank you. Sorry. And our final panelist is our own beloved professor, Dr. Ken Dunnington. He is Associate Professor of Philosophy. He teaches and writes in the areas of virtue ethics and theological ethics. His research interests include addiction and criminal justice and were inspired by his time and his experiences teaching in a prison. He holds degrees from Southern Nazarene University, Texas A&M University, and Duke University. And what I've come to appreciate about Dr. Dunnington as we've worked together on planning this series is his ability to take something as complex as addiction and make it thoughtful and clearly straightforward so that we can ask the thought-provoking questions about how we live life and how we do that with others. So join me in welcoming Dr. Ken Dunnington. So a couple things, we actually are gonna have a lunch with our panel, and so we have 3 more spaces available. So at the end of this chapel, if any of you are interested in joining us for that, it's free. You can sign up with Tessa, she's in the back in the lobby, so keep that in mind. And then also we have resources available to you. So there's gonna be a link that they're gonna put up on the screen. And so as we have these conversations, we want to be able to resource you well. So if you go to this link, you can just even type in student development at Biola and type in addiction, and this link should pop up. There's a list of resources. Pastoral care is on there, spiritual direction, our own Biola Counseling Center, some books that might be some good resources for you. So we invite you to check that out. In addition, after chapel, Dr. Dunnington will be selling his books for 45% off. So if you're interested in checking out some of his research, feel free to look at that in the back. And then as we continue to talk, if you're interested in any of Dr. Lemke's work, she's going to be giving away for free some of the copies of her book. So feel free, if that would be a helpful resource for you, to come check that out in the lobby after. So I'm really excited that we get to have this conversation as a community. I'm very mindful of the fact that you all are going to go home soon and that you're probably going to be off contract very soon, and that some of these questions might impact us personally, but then also might impact our families. And so it's good to have these conversations together. So we're going to go ahead and get started. Our first question is addiction a disease? So feel free to jump in.
So first I want to just comment how impressed I am at how present you all are here. I don't see many people on their phones or on their computers. I see a few, not to shame you or call you out, but it's really rare these days, especially among your generation, to see people come together and really be present together without the distraction of some sort of device, and I'm very moved by that you're able to do that. Addiction is so much about this kind of not being present, really, about kind of checking out. And we're all vulnerable to that. We crave that non-being, and that's actually normal. And yet one of the ways to, fulfill that need for non-being is to be incredibly present and to be in the moment and to kind of come together around conversation or song like you guys just did. So I'm really impressed that you guys can do that and just sort of sit here and be in the moment. And I just wanted to say that. So is addiction a disease? I believe addiction is a disease, but it's kind of an unusual disease in that it is really informed by the environment. So if we compare addiction, for example, to schizophrenia, which is a disorder where people hear voices or they believe in things that aren't real, the rates of schizophrenia have remained fairly constant across different countries, rich and poor, and across the centuries. But addiction is different in that it's what we call a stress diathesis kind of disorder, meaning that everybody in the population is vulnerable to addiction to some extent, and that vulnerability will depend on the environment that they're in. So if you're in an environment where there's lots of access to drugs, alcohol, pornography, or other highly dopaminergic stimuli, dopamine is a neurotransmitter which is released in our reward pathway, and if in addition to being in that kind of environment, and let's face it, that's the world we live in now, that we're surrounded by opportunities to stimulate dopamine in very potent and ever increasing ways. If you're in that kind of environment, plus you have that innate vulnerability that's probably genetic and also informed by your growing up and your what we call epigenetics, right? Epigenetics is the way that your experiences turn on and off certain genes in your body. Then you are vulnerable to this disease that we call addiction. So I do believe it is a disease, but I believe it's very much informed by this stress diathesis model and your own innate vulnerability. So I'll kind of leave it at that. But because of the world we live in, and it is a crazy mixed up world, I think by anybody's measure, the rates of addiction are going up, and we're all increasingly vulnerable to this problem.
Well said. By the way, it's nice to be back and nice to be in chapel with you all. I think I was mentioning to Ken, I think this is the first time actually I've been in chapel. Rosemead, we had our own chapel, and so it's nice to see all of you out there, and thank you for having me here. Interesting question, is addiction sin? And I think Anna beautifully talked about the biophysiology of addiction and the environmental issues. Now, having been to Rosemead and have the integrative piece, for me, addiction is a biopsychosocial, cultural, spiritual issue. It integrates almost every part of our life. And if we separate out, understand the physiology of it, the biology of it, the question now is, when does it become sin? And is it sin? And my position is that it's not sin in and of itself. I just look back to a passage here in James 4:17, that if we know to do good and do it not, it's sin. So when we take things into our bodies that we know are damaging, is going to be damaging and unhealthy, then we're violating ourselves, and to the degree that we do that, then it becomes a sin. But addiction in itself is such a broad spectrum problem, and it's very important that we don't think of it as sinful. But it's very important that we pay attention to our motives in use of substances.
So I don't think addiction is a disease. It's something that Anna and I have talked about a lot. But I agree with almost everything else that Anna said. And I think the disease understanding of addiction is so important because it's a better alternative than what's usually presented. So typically if people don't think of addiction as a disease, they just think of it as a collection of sort of willfully bad choices. And if you've ever been yourself personally addicted or known people who are seriously addicted, you know that that can't be what's going on. There's a kind of compulsiveness and a bondage to addiction that means that describing it as a simple series of bad choices just doesn't fit the bill. So I tend to think of the disease concept has been so helpful, I think, because it removes the moral stigma that Audrey was just talking about. And to the extent that it does that, it's a great good. It's also helped people get insurance coverage for treatment for addiction, which is also very important. And because of the disease concept, there's been a tremendous amount of research. I mean, this is what Anna does, research into the biological dimensions of addiction. And we're human beings, so everything about us has biological dimensions, but addiction has profound and deep biological dimensions, and the disease understanding has helped us to get a grip on some of those things. I tend to think of addiction as a complex habit that habituates our minds and our emotions and our bodies, and it's because of both the way in which it habituates every aspect of what it is to be a human person, and because addiction connects us to things that promise to fulfill some of the deepest needs that human beings have. Those two factors, the fact that it's such a complex habit and the fact that it directs us to the deepest goods that we desire as human persons, is the way that I think of the power of addiction.
I guess, Ken, I just want to challenge you a little bit.
I knew you would.
You know, what I see clinically is that in the early stages of addiction, there is this element of choice. Mm-hmm. But when in this case of very severe addiction, I feel like people really do lose the ability to choose, and that's when it crosses over into something that I think is really akin to, you know, this metaphor of the hijacked brain, mm-hmm. where the frontal lobe, our decision-making capacity, our ability to delay gratification, to process new information, to put the brakes on things, really gets separated from our limbic structure, our emotion brain, our reward pathway, and we no longer have the ability to control those behaviors. And that's where really I think you need, you know, medical intervention in order to help. So if you or somebody that you know is at a place where you have perfectly good preserved insight into the fact that this is a behavior that you want to stop, that it's self and other destructive, but despite your best intentions, every day you get up and say, I'm not going to do this today, at the end of the day you've done it again, I think it's really time to go seek some professional help or some spiritual help, but definitely get help, because there is a point when it is out of control, and I would define that, the crossing, when you're crossing over to really a pathological brain state that's beyond habit or choice. But Kent and I, we love to have this discussion, because we'll disagree till the end of time on this, but I just wanted to put that out there.
Hello, losing it? Okay, Dr. Lemmy, I'm gonna start with you on this question. So is there an opioid epidemic in America? What does that mean? And is it something I should be concerned about?
Okay, so the question is there an opioid epidemic? There certainly is. More people die every year from opioid overdose than died at the peak of the HIV epidemic, so about 50,000 people are dying of drug overdoses. Opioids are things like heroin, illegal opioids, but heroin is essentially identical to prescribed opioids like Vicodin, Percocet, OxyContin. And we are in an opioid epidemic because of the high death rate and because of the high numbers of people getting addicted. And what's really complex about the opioid epidemic is it originated with doctors' prescriptions. So let's say you have a wisdom tooth removal and you go in and you get maybe a month's worth of Vicodin for, as I said, vulnerable individuals. Again, we've got that stress diathesis model, right? You've got the innate vulnerability, probably genetic, inherited, or probably epigenetic from trauma early on, and then you're given a bottle of Vicodin and you take it, and not only does it relieve your pain, but it also maybe calms you down or gives you energy or makes you less anxious. So it solves this other problem for you. That is an individual who is potentially prone to go on to become addicted to that pill in a complicated way because it started with a doctor's prescription. Not just opioids for pain, but also stimulants for attention deficit disorder, which some of you may take, or sedatives like Xanax for when you're anxious. All of those are highly potentially addictive medications prescribed by a doctor, which can be a gateway to an addiction phenomenon. But we maybe rationalize to ourselves that it's not a problem because we got it from a doctor. So those are the kinds of things to think about if you happen to be taking one of those medications prescribed by a doctor and you're kind of wondering about your use. Be mindful, be thoughtful, and seek care or guidance if you're concerned about that.
I have a follow-up question to that. So let's say that was my situation. And I started just kind of like getting some red flags, maybe remembering some of the things that we've talked about here. What might some of those indicators actually be?
So, the trajectory from recreational use of drugs or alcohol or the internet or pornography or shopping or whatever it is to addictive use is really amazingly similar across individuals and ethnicities and backgrounds. And what you want to look for is, first of all, intermittent use progresses to daily use. That's very concerning. If you're taking a prescription medication daily, then maybe instead of taking it once daily as prescribed, you're taking it more than once daily. You're maybe trying to get it from other sources, get it from friends, get it from the internet. What we see over time is that because the brain builds up tolerance to the effects of that drug or that behavior, you need to do more and more to get the same effect, or you need more and more potent stimuli in the form of maybe more deviant pornography to get the same stimulus. Then over time, you start to lie to people about what you're doing. So this double life phenomenon is incredibly common in addiction. And whenever the insides don't match the outsides, we really set ourselves up for psychological torture. Whether we're talking about, your inner struggle with your faith and what you tell your friends, or your inner struggle with your behaviors and drug or alcohol use and what you're telling your friends and your loved ones. When that mismatch starts to happen, that's very concerning that you may be on the path to some sort of addiction. And then the other thing that I think is really telling is when we start to have a victim-oriented narrative about our lives, blaming everybody else. Oh, I have to use that drug because of X, Y, or Z, or anybody would use drugs given, my life circumstance. So when I hear that, I know that people are in trouble as well as the more obvious physiologic things where when you miss a dose, you start to experience withdrawal, things like that. So those are the things to look for.
Thank you. I have a question I'd like to direct to Dr. Seaton-Bacon. How can we help people who are addicted? What does it look like to walk alongside them? How should we respond in community? Could you speak to that for us?
Sure. The first word that comes to mind is compassionate helping. Anna talked about the physiological part of addiction, and it's very, very entrenched and very hard and very painful and difficult for people to walk through, actually to walk even into a clinician's office or a medical office to get help, because there's such embarrassment and pain and shame about becoming an addict. And it's very important to remember that there's a biological piece to this that is memory. Our bodies remember, our emotions remember, our neurobiology remember, neurotransmitters remember. So when we start a process and become addicted, the entire system is biologically now wired to go after whatever that substance is. It does not mean that we do not have, or we cannot override that. I think sometimes when we get caught up in the biology of something, we feel stuck and think, I'm completely now helpless to the biology of it. But it means that we need to take a look at ourselves and move into a place of willingness to change. There's a helplessness that comes with being an addict, and it's very vulnerable. So the first step, and why I say compassionate helping, is to come alongside in a place of vulnerability and to say, this is tough, this is hard, this is painful, it is absolutely scary. The second step is to be able to sit with someone in a place of pain. It's very difficult. It's easy to judge. Well, you shouldn't have, but it's so difficult to say, I get it. I may not understand all of the reasons why you began the journey, but you're here and it's painful. Let's work through this together. Another piece that's important is community support. This is very difficult to do on your own. You need you need a team of individuals to help. We need physicians to help us through the biology or the pharmacological pieces of it. Sometimes the addictive process can create physiological disease and damage to our system, and we need medical intervention. We need 12-step programs. Now, regarding 12-step programs, some are better than others, and there's also conflicts within those programs. One of the pieces that I remember in dealing with a gentleman who was in AA was the fear of taking medication. He was just terrorized with anxiety, but the 12-step program told him that he could not take any medications at all, and he struggled in trying to work through his healing process. So it's very important that we have accurate and correct information, be selective in terms of where we go to get help. And then it's nice to have family and friends who are also supportive, your church, your community. And then for me, it's very important to have clinical psychological care. And the reason for that is because many addictions serve to cover up other processes, other psychological processes like anxiety. I was sharing with my colleagues here that when I first became aware of addiction was back, I think, in 1987. I was working at Adolescent Treatment Center in Baltimore, Maryland. And I saw an adolescent first thing in the morning at 9 o'clock appointment. And at that point, he drank a 12-liter bottle of Coca-Cola before meeting with me. And that was his way of starting his day. He was feeling depressed, and he needed an up. And it started for him as a way to self-medicate and moved him right into a place of addiction. So there are many reasons why people start, and we cannot judge. We must embrace them with mindful acceptance and a compassionate ability to walk alongside to support them through the process.
Thank you. I want to open this up to the whole panel. Biola is a community that we have a set of community standards. And there are some strengths to having a place where there are some set guidelines that help us to walk together in community. There are probably also some challenges with that as well. And I'm also very mindful of our students once they graduate or once they go back home or wherever for the summer and they're off contract, then what does it look like to pursue the good life? How do we be mindful of the things that we need to be mindful? Do we make rules for ourselves when we get out of here because those make us feel safe because we had them before? For some of us, the reality is that there are probably people here who are actually not abiding by those community standards at the same time. So then how do we navigate even through guilt or shame or just denial that comes with that? So what are the benefits? What are some cautions? How can we think about this well?
Well, I think to live in the world today, we all need to find self-binding techniques to make sure that we limit our consumption of highly rewarding, pleasurable activities. You know, we are evolutionarily adapted for a world in which basic survival is our main focus. We have to spend in a kind of ancient world much of our time finding food, clothing, and shelter. That's no longer true. Basic survival is taken care of, and we live really in a world of incredibly exaggerated plenty, and we're highly encouraged through all kinds of capitalist messages to consume, consume, consume. So self-binding techniques, things that we do to make sure we don't over-consume in a pathological way, is something that is part of basic survival. My personal self-binding technique at one point was getting rid of my Kindle because I actually think I became addicted to romance novels. It started with the Twilight Saga, and it ended with 50 Shades of Grey. When I was reading 50 Shades of Grey at midnight and I got to the part about butt plugs, I had to sit up and say, something is very wrong here, right? I've got 4 kids I gotta get up for and make lunches. I gotta go to work. What am I doing? So I got rid of my Kindle. And for that for me was really key. So you guys are in a community that binds you, right? And frankly, that works. It works when you have limits set on you from the outside. But if you're not in this kind of community, and first of all, if you're in a community where you are breaking those bounded contracts, either you're a rebel and you just want to just say, I'm not going to do that, or you might actually have some kind of problem with substances or behaviors, or it's more complicated than that. But think about, well, why do I actually do this? When you get out of this kind of environment that binds you, Then you got to come up with your own self-binding techniques, and you got to use your own creativity to figure out what those are. My patients come up with any number of things. Some of them don't keep alcohol in the house. Some of them give their credit cards away. I personally don't have a smartphone because I'm quite compulsive, and I know that I'd be checking that thing all day. And I just want to stop there and say, for everybody in this room who feels you cannot personally relate to addiction, think about how many times a day you touch your phone. And think about what it would mean for you to put that phone down for even 24 hours and not check Snapchat. Is Snapchat the main thing now? I don't know. It keeps so fast, I can't keep up with it. Anyway, I challenge you to do that, because I bet what you'll experience is actual physiologic withdrawal from not checking your phone for 24 hours. Or if it's not the phone, anything that you do to kind of self-soothe, give it 24 hours of a break and see what happens to you. So that's my kind of self-binding answer. We all need to do that. We find ways to do that. We enter communities that do that for us. There are pros and cons to that. But as you go away for the summer and you're not going to be in this environment, be thoughtful about what some self-binding techniques you can do. Not even for religious reasons necessarily, but just for like safety and healthcare reasons.
My thoughts about that is the purpose of the laws or the rules or regulation. And it's very important to understand that they create safety for us. They give us a place, very much like the walls in this building. If we didn't have the structure of the building, we wouldn't have safety to be able to come in and talk. So it's very important to understand the purpose that rules serve. Now, because they serve a purpose for us doesn't mean that we are enslaved to them. It's very important, in my mind, that we understand, especially in this age group, why we're here and what we need to internalize from the legal system or the rules that we have to live by. And the best way that I can communicate that to you is through the idea of parenting. One of the things as we move into adulthood is being able to take those reins from our parents and from the society or schools and begin to parent ourselves well. My clients laugh when I tell them I have to tell myself when to go to bed. There's certain things that I have to tell myself, and those, when you think about it, are rules that we follow or that was imposed upon us when we were growing up, and we didn't like them. Alcohol use, drug use, these are rules that we've understood here at Biola, and I remember even as a student signing that contract that we couldn't drink. And at the time, as an adult, I thought, wait a minute, I can drink. I don't have to sign this contract. But I understood that Biola created an atmosphere and wanted to create an atmosphere of safety for us to explore. And when you move beyond that, you could now parent yourself well by governing yourself and telling yourself how much you can drink. As an adult. So think of it as a launching pad to begin to parent yourself, learning what those rules are, the reasons why they're in place, and to prevent things like addiction, to prevent things like abuse, and not to abuse self. And once those are internalized, you're then free to live your life according to an internal set of rules that will bring you safety and allow for pleasure and comfort in your life.
Dr. Dungeon, did you want to say anything at the end?
I'll just say one thing really quickly. I went to a school a lot like Biola, and my experience there is the only thing that gives me pause about the contract. The good thing about the contract is it creates a space where you just don't have to worry about the distraction that drugs and alcohol can make, and we know that alcohol and academics just don't mix very well. So it's good to be in this space, but I went to a school like this and I thought, nobody ever told me, but because of the community standards, I thought that really good Christians didn't drink. And when I later discovered really good Christians that drank, it was really confusing to me. So if the function of the contract in our setting is to create in you ideas that suggest that being a good Christian means that you wouldn't drink alcohol, then the contract is failing you, and we're not doing a good job of talking about why we have it. I suspect that when you leave here, most of you are going to begin to try to form responsible relationships with substances like alcohol, and that's for the good. There's no problem with adopting an abstinence policy, but don't turn an abstinence policy into moralism. If you think the most interesting thing about being a Christian is that you don't drink, we just haven't done a good job of teaching you what Christianity is.
Biola University prepares Christians to think biblically about everything, from science to business to education and the arts. Learn more at biola.edu.